Good morning, everyone. Welcome. I'm going to start this off. If everyone doesn't mind, I think if we just kind of do a round of introductions. I really appreciate everyone joining us here today. So I'm Cindy Gillespie. I'm the secretary here at DHS for our Let's Talk. Dr. Greenfield, would you mind introducing yourself?
Sure. Sam Greenfield. I'm the Medical Director for Family Health at the Arkansas Department of Health. I guess that's it.
We really appreciate you being here. So Shakenya, would you mind introducing yourself?
Yes, hello, I'm Shakenya Tate. I am the nursing coordinator here at Conley Human Development Center for Administration and Quality Assurance.
Wonderful. And Jeff, would you mind introducing yourself?
Sure. Jeff Williams. I'm the Director of Emergency Management, Security and Safety here at DHS, and assisting in coordinating our COVID response.
Okay. And our wonderful sign language interpreter, would you mind introducing yourself?
Hi, everyone. My name is Jonathan Smith, and I am a nationally certified interpreter here for this meeting today.
Wonderful. Thank you very much. And thanks to all of you for joining us. We've been getting a lot of questions. I know I always have a lot of questions around the COVID-19 vaccines. And so we thought we'd take a few minutes today. And I really do appreciate our medical experts and Jeff, our head of our COVID response, joining to try to answer some questions that you all have been asking. As we start this, I do want to start with making sure something is very clear to everyone. This is an emergency use vaccine. We are not mandating here that you take it. However, we really are encouraging it. We really believe it is important for all of us, as well as for all of Arkansas, for these vaccinations to occur and to occur as quickly as we can do them. So I assure you that the minute I am eligible for a vaccine, I am going to get my vaccination. My 83-year-old mother in Georgia is getting hers today. With that in mind, a lot of you have asked if it is mandated. It is not, but we will be continuing to try to encourage you and educate so that answer your questions so that hopefully you will take the vaccination as soon as it's available for you. So with that, we've begun the vaccinations among our employees. They've been rolling out at our facilities and with our residents. We're going to cover really two things today. We want to answer questions around the vaccine and safety, and then talk with you a little bit about how the rollout among the rest of DHS is planned to occur. And so we'll start first on the safety of the vaccine. The core question we get from everyone, and I think Dr. Greenfield, if you don't mind, I'm going to start this conversation with you, is that people are worried because the vaccination was approved so quickly. Normally it takes years. This one happened very, very quickly. So people are worried about the safety. We're steps skipped in this process. So can you address that a little bit?
Absolutely. I think a major concern is the speed with which everything came available. And I think you have to consider that a lot of this where we are now is built on information that we knew in the past. This is SARS-CoV-2, there was a SARS-CoV-1. And so there was an education process that was started then, and there was a MERS around 2010. So we've seen the coronaviruses in the past. This is obviously much more impactful on the world and on our community. And so we had a platform to start with. So this did not just start in January with no prior knowledge. Yes, we did get to a quick product to get the emergency use authorization to become available. However, this was, and it is a new vaccine design. However, the steps by which this vaccine has come through the phases, what has been a little bit different is that the phases of approval or phases to authorization were combined. So This was indeed a large trial. This was not a modified or a changed trial in terms of the standards by which something would be approved. This was not a changed trial in terms of what we're actually looking for in terms of efficacy. What we found was that the standard was going to be around in the mid-50s, which would have been an acceptable response. And what we found is that the efficacy turned out to be in the 90s, in the 90%. So we got a good response from it. And so I think one thing people should rest assured is that, yes, it sounds like things went fast. And when we talk about warp speed, part of that warp speed I think you have to consider is distribution and getting it to the public. There are a couple of things to consider. Yes, I understand that people are accepting of vaccines, but vaccines alone will not do it. It will be vaccination. That's going to be the key. And I understand that people are concerned about trials versus vaccination. The trials have been completed. So we are in the vaccination phase. So having this on the shelf and not in our arms will really not do us any good. If we are going to get through this and to the other side, I think the thing we have to consider is one, trust. Okay. And I would say I would refer everyone to the Department of Health's website where we have the grand rounds that are archived. And you can see one as recently as last week when Dr. Romero gives a wonderful detailed explanation of how we got here. And I think that will actually go a long way to understanding how we got here and how we can go to our next step forward.
You know, you mentioned the trials, and I think that's another area we get a lot of questions about is who is this safe for, right? People worry about how broad were the trial participants, who all was represented. For example, were African-American and Hispanic people represented in the trials?
Yes, definitely. So African Americans, Hispanics were represented in the trials. It represented about a fifth of the trial participants. But unfortunately, the same things when we have issues of trust and concern and vaccine uptake, those same things can extend into the trial phase. And in some ways, probably to a larger degree, but African Americans made up about 10%, Hispanics about 20-25% of the trial participants.
Okay, all right, good to know. So you mentioned that it was a new vaccine design. And I think there's been a lot of questions around that, this mRNA technology, that it's never been used, and why should people be comfortable getting a vaccine with a brand new technology?
Right. Well, I think this has been something that has been in development for a while. Yes, this is new technology. And I understand when we have concerns about, I don't understand how it works. But what we do know is that this is not a live virus that is being injected. I think that is the important thing for people to understand, is that this is not something that will give you COVID. This is new technology that essentially sends the message to the cell to create just a component so that the body then develops an immune response. Now, the wonderful part about this compared to traditional vaccine development is that it allows us to get to a point of vaccine development in a much faster and a safer way than we have before. So as we go through this pandemic, or if there are modifications or mutations which do occur with viruses, we will be in a better position to adjust and adapt going forward. But understandably, yes, I do have the concern that people would be concerned about the fact that it is new technology, which is why I say what I like to provide is information and guidance. People ultimately will have to make their own decision and decide who they trust, what are trusted resources. And while we're doing things like this, you should also know that there are a number of places that you can go to find the answers that you need to help put any concerns that you may have to rest.
Okay, no, that's really, really helpful. Shakenya, let me bring you also into this conversation with Dr. Greenfield. Can y'all talk a little bit about who can take the vaccine? I mean, we're getting questions, for example, around allergies. If I'm somebody who normally has an allergic reaction, should I be taking it?
Right. So there's been a lot of question about, well, I have seasonal allergies, or I'm allergic to this, I'm allergic to that. Is it safe for me to take this vaccine? So in the trial studies, the recommendation is if you have never had a severe anaphylactic reaction to an injectable vaccine, then you can make the decision, the choice to take this vaccine. Of course, it's always recommended that you talk to your doctor, talk to your healthcare provider about your allergies and your reactions to certain things. I personally have seasonal allergies, but I opted to take this vaccine and I've felt perfectly fine. But it's always recommended that you discuss those things with your doctor and discuss it with people that you trust. If you do decide to take the vaccine, it's recommended that you stay in the facility and that you are observed for at least 30 minutes. Those who are healthy and don't have any preconditions or other coexisting criteria, 15 minutes is reasonable. But if you do have those allergies and have had allergic reactions to other things, it's recommended that you wait and be observed for 30 minutes. And also before you get the vaccine, just make sure that the facility where you're getting vaccinated, that they have the equipment to take care of you if you do have a reaction. So in case you need an EpiPen or some oxygen, just make sure that they have those things available before you go ahead and decide to take the vaccine.
Okay. What about pregnancy? If someone's pregnant?
Sure. Well, my background, I'm an obstetrician by training. And so I think one thing is pregnant women were not included in the trials. However, the American College of Obstetricians and Gynecologists and the Society for Maternal Fetal Medicine have all come down and said, obviously going forward in an ideal situation, we would want pregnant women to be in the trials, but where we are right now, they weren't. So the question becomes, is it available for pregnant women? And the answer to that question is yes, it is available. Now, it becomes a very personal question that one has to make a decision about, and it should be a shared decision-making process between the patient's physician about what is actually going on. What we do know is that for pregnant women who develop COVID, their risk of having preterm labor does go up. And for those pregnant women who develop COVID, their risk of getting a very severe condition, really sick from it, is greater than in the general population. So you have to sort of weigh, what is your exposure? What are your risks? You may consider what's your occupational risk? What is your personal risk? What is your family risk? A host of things. And as we've seen that this is so present in the community now, and very plainly put, I think we have at some point in time all been in the presence of a patient or someone, whether we knew it or not. It's very likely that we have been around it. So for pregnant women, it is available. Pregnancy is not an exclusion to not get it. And if someone wants it, then they can get it. And when I discuss it with my patients, I do encourage them to strongly consider it and get it.
Okay. That's useful. Kenya, I know that y'all have had at DDS, over at DDS, where you have been giving the vaccines at the facilities. One of the questions I know y'all have had several people ask you is about, if I've already had COVID, should I take the vaccine? Doesn't that make me immune, right?
Right. So several people have, yes, asked that question, and it is still recommended that you still take that vaccine. Of course, they're recommending that you don't take it if you're acutely ill or are having symptoms, and that you wait until you have been released from your quarantine to take the vaccine. Some studies have shown that you can wait up to 90 days because it's very uncommon for you to get COVID within that 90-day period once you've been positive. So if you want to wait that 90 days, that's perfectly fine. But yes, it is still okay to take the vaccine even if you've been positive in the past.
Okay. Do we know yet how long this vaccine will last? Or will there need to be a shot every year like the flu? Or do we have any sense of how that will work?
We don't know exactly the duration of how long this will last. And I think that will be part of the ongoing issues. And I think that really hits the point as to why we will ask people to continue to wear the masks even after they have been vaccinated, because we don't know exactly how long this vaccine will last, okay, or if a booster will be needed.
Okay. That was, yeah, one of my questions was actually going to be, will I still need to wear a mask if I've had it? And the answer then is going to be yes, we will still be wearing masks for a little while. So we've also had a number of people say, well, why, if those that I work with are taking it, why do I need to take it? I mean, if they're willing to all take it, and they pretty much get immunity, then it's not going to spread among us. We'll have, I think y'all call it herd immunity is the term we've all learned to use. So why do I need to take it if once we have herd immunity coming, right?
Right. So that's an assumption that your coworkers all took it. That's number one. Number two, you spend life outside of your job. That is another factor as well. And when you consider the fact that you may be at risk when you're somewhere else, you may be at risk when you go home, to achieve herd immunity, that will take time. And as we've said, there are still things that are unknown about this. Even after we have had people who've been adequately vaccinated, as we just said, we don't know the duration of time that they will actually, in fact, have immunity. So I think it is really two factors. There's a sense of sort of obviously protecting yourself. That's a reason to do it. There's a factor to do it to protect your loved ones. In my opinion, there's a factor to do it to protect your community as well. Herd immunity, ideally, we will get there, but right now we are in a very early stages of vaccine rollout, and until that gets to be an issue, then I think you can have to consider you're still walking through with this risk.
Okay. Are there any people who should not take the vaccine that you would want to, either one of you would want to call out at this time?
Well, the concern, obviously, if there was someone who had a known allergic reaction, that would be one. Individuals who are actively in an active phase of infection right now, that would not be a time to get the vaccine as well. And then, so those are the things that we do know.
Okay. All right, good. That's useful. Shakenya, you have been getting a lot of questions from a lot of our employees. Is there any issue we have not addressed that you are commonly hearing from a lot of people and want to make sure we do answer that question?
Well, just the majority of our feedback has been, I kind of want to see what this does. So people are just a little hesitant about taking the vaccine because they want to get more data and see the statistics before they agree. It's not that they don't really, that they're really against the vaccine. They just want more information. So that's kind of the majority of the concern that I'm hearing. Some of the other things that I've heard have been, is there some type of chip in the vaccine? They're injecting some type of chip in my arm. So I've been able to talk to some staff about that's not true. That wouldn't be safe for us to do. Another thing that I tend to point out also is that the first group of people getting this vaccine are the healthcare workers. So do you think that healthcare workers would be taking on the first load of this vaccine if it was unsafe? So I use myself as an example because I know sometimes, even with people's hesitancy, I feel like if we're upfront and honest and leading by example, you'll get a better outcome from it. So I leave my number for people to call me and ask questions. So I just think if we're upfront and honest and transparent, people will be more apt to take this vaccine. So that's really the biggest concern, is just wanting more information before they agree to move forward with getting the vaccine.
It's wonderful. Okay, great. No, it's funny. I just got a text from my mother reporting that she just left after getting her vaccine, and she's 83, had cancer, she's and she's doing great. So I will feel better knowing that, because I've been very worried about her and the potential that if she were to catch it, what could happen. Dr. Greenfield, is there anything else you would want to say to folks around safety before we start talking about rollout here at DHS?
In terms of safety, I think the one thing I would encourage folks to do is to have strong consideration about what they will do when the opportunity comes. Right now, it is being distributed and administered in very specific ways. And sometimes when we have the opportunity, if we pass that opportunity when it's our turn in line, it may, not to say that people will be able to get it, but getting back in the queue that queue will likely be longer as we go through these phases. And so you want to have your decisions made when the time comes. And so things like this, anything that you can do to gain information so that you can be prepared will be important.
Wonderful. And again, as you said, there is good information on the Department of Health website, videos, written information, et cetera, that can help people with their questions. And at the end of this, we're going to talk a little bit about our rollout, but at the end of this, we will also give you some contacts here at DHS who are, as Shakenya has been, willing to talk with you and help you get comfortable or understand your, answer your questions, help you find the information you need so you can make the right decision. We do have real experience with this already here at the agency. We started before Christmas vaccinating at the Arkansas State Hospital. We have now moved into the Human Development Centers. That we've had over 1,600 of our staff and our residents that have already been vaccinated. So Jeff Williams, could you talk a little bit about how that rollout has gone out?
Sure. As you've already mentioned, we started this back just before Christmas. We've already rolled it out to the Human Development Centers, the Juvenile Treatment Centers, the State Hospital, and to the Health Center. The rollout, it really has gone very well. They've worked very well with the COVID management team to get it out. The facility participation has been great. As I said, as you've already mentioned, over 1,600 participants that have done the project, and we're continuing to do that because we're continuing to educate our staff at those facilities and the residents at the facilities. But our numbers have looked really well, and the vaccine's been received well. And in fact, in some cases, we've begun a pretty good now rollout of our second dose. And that also has gone well. So the initial rollout is going well, being managed well at the facility level, and now we're ready to make it available to a broader audience.
And I know some have asked about concerns about being elderly and taking the vaccine, but at our facilities, our residents at the health center, many are elderly. Our residents at the HDCs, many are elderly, and they've been able to take the vaccine with no reactions.
Yes.
Okay.
Yeah.
Most common reaction that people have is what? Sore arm?
Yeah, that's it. We have not. I've had no reports of any severe reactions to it. And it makes sense. If you get somebody sticks a needle in your arm's going to get sore. And that's the primary thing. We've heard of a few people with some minor things that they've gone out. They talk about maybe a little bit of soreness. The next day they may have some sniffles, some little things with sinuses, but it's been minor. And most of those, even those who have had it, have only reported that they've lasted for about 24 hours and they were back to normal. While the vast majority of them outside of where they got the shot have reported no symptoms whatsoever.
Okay. And Shakenya, that's been your experience.
Yeah, so I've heard a lot. My arm feels really heavy. My arm is sore. I've had some report fatigue and just mild symptoms. Wanting to sleep all day. I had a headache. I had a low-grade fever, but most of the symptoms that have been reported here have been fairly mild.
Okay, great. So the vaccine will soon be available to the rest of the DHS employees. We are moving into that phase. Jeff, can you talk a little bit about how that is going to work here? How will
Sure.
an employee know that they're now eligible?
Right. A portion, if any of you had the opportunity to see the governor's press conference earlier, a portion of the 1B population will begin receiving availability of the vaccine coming Monday. This I think it's the 18th that's going to be made available to them. And the rest of the essential worker, the 1B crowd as it is, which is all of DHS's workers, it'll be made available to them. It's expected by the end of February, mid to end of February, possibly even beginning at the beginning of February as this rollout goes. And don't worry, we'll be notifying everybody about the availability. Once it becomes available, you'll be inundated with messages and information on how or when you can go out and begin the process of getting the vaccination. As I said, it's scheduled to begin sometime in February. The way that this is going to work for the majority of DHS workers is that you're going to be notified that you're now eligible. You'll be contacting whether it's a local pharmacy, a local clinic, or maybe your primary care physician, and coordinating with them receiving the vaccine. Most of them will take your name and number. They'll schedule with you a time for you to come down and receive the vaccine. And then once you've got that scheduled and you go to the vaccination point, what we're going to be asking you to do is to bring with you one of two things. For those employees who have an employee ID, take that with you. That's going to be identifying you as an essential worker available or that has access to it as part of the phase 1B. We do know that some of our employees do not have an employee ID, and that's fine. What we're going to be doing is we're going to be forwarding out to those employees a note, a little letter that's going to come to you. It's going to be on DHS letterhead, and it's going to be available for you to be able to take that to that pharmacist or that clinic or to that doctor to show that once again that you are eligible under phase 1B to get that. And then once you get that shot, they're going to give you, it's either going to be a little card, it may be a note from your doctor, whatever, that's going to indicate that you have received the vaccination. And what you'll want to do is just for your own personal records, you'll just want to retain that card. Just so you have it for your own individual records. And then they will also set up a time and a date for a subsequent for your second dose. If you're getting the Pfizer vaccine, they're going to be looking at being able to give it to you about 21 days later. And then with the Moderna vaccine, it's going to be looking at 28 days later. But they should be scheduling that with you when you arrive at that pharmacy to be able to get your initial vaccine. One thing I will ask you to do is you can go to the Department of Health's website, and it's healthy.arkansas.gov. You'll be getting that information as well. And on their site, they'll have maps and different lists of pharmacies, et cetera, that have the vaccine available. You can click on those links, get the contact information for the pharmacist, for the pharmacy, the doctor, or the clinics that are having those available to you. Call them and schedule a time for you to be there. Don't just show up. There may be drive-up clinics that may be available. And of course, at that instance, you can go ahead and use that. But call to make sure that they have it available, and call to schedule a time and a date for you to be able to go and to get your vaccine. And in fact, there are a number of pharmacies and doctors that are already scheduling. They're putting together waiting lists of individuals who want to get the vaccine, even if they're under a later phase, such as the one DHS is under, that 1B. There's nothing wrong with you if you have a pharmacy and you want to put your name on that waiting list. There's nothing wrong with you from going ahead and doing that now.
Okay. So just to repeat and make sure I say this correctly, Jeff, as groups of our employees become eligible for the vaccine, as it's their turn, we're going to notify them. So you'll hear from us. And you will then need to schedule an appointment to go get your vaccination, most likely at a pharmacy, a clinic, through your doctor. It may be by that time, as you said, it's some of the organizations have actually just set up drive-throughs where you go like you do for testing, and you go and you get a vaccine and you don't have to schedule an appointment. But they should plan that they will probably have to schedule an appointment. So you don't have, at this point, because I saw somebody ask the question, what if I miss Monday? Monday is not the day, right? Monday is when the state moves into 1B. And then as we are in 1B, somewhere in the next few weeks, DHS employees will become eligible to get the vaccine. We'll notify you when you are eligible, and that's when you will go schedule something.
Right.
Saying that correctly? And
Yes.
Okay. And when you go, what you will need to show is proof that you're a DHS employee. And so that can be either your ID, or if you don't have an ID, we will give you something on DHS letterhead so you can show that you are a DHS employee.
Right.
Okay. All right, good. I know there's going to be a lot of questions. A question just came up. Does our insurance pay for this vaccination?
Yes, you will have coverage regardless of your insurance status. They may ask for your insurance card because they may bill an administrative fee, but you're not going to be charged for this.
Okay, great. Dr. Greenfield, anything you would like to add about how the vaccine, what that employees should expect around when it's their turn?
Right. Well, I can speak as someone who's received both shots of the Pfizer vaccine. And I can tell you that the injection itself was less painful than the flu shot that I received. I had a sore arm the following day, and that was it. It was a rather uneventful episode. So that's just simply my personal experience, and that's been largely the experience of the majority of folks. As we kind of mentioned the other things that have been there. I did see one question that popped up that said, what's the difference between the Pfizer and the Moderna? They are built on the same concept, the same technology of the mRNA vaccine. They're just simply competitive, different products. But you cannot go between the Pfizer and the Moderna. You can't start with one and finish the other. With the other, and you should be sure to get both shots to complete the vaccine series. So that is the thing I would encourage. And keep in mind that after the vaccine, that does not mean you take off the mask. It does not mean we eliminate our social distancing and we stop washing our hands. We still continue to use the good practices.
Okay, all right, good to know. Well, it's coming very quickly for the rest of DHS. So it's good for all of you. As everybody said, go ahead and do your homework. Go ahead and look at the educational materials. Get ready so that when you get notified, you will be, if you're going to take it. And I hope if for those of you that don't have a real physical reason, don't have a reason not to, you will take the vaccine so that we can begin to move us as an agency and as a state towards herd immunity. I hope everybody will do your homework, make your decision. One of the things we do want to encourage, we're going to put up we try to keep this meeting short. So we're going to put up a slide now. I'm going to ask our friends at IT to do that. That gives you contact information here. Jen Schuler, many of you know Jen, and then you just met Jeff. Jen Schuler is an APRN, and she and Jeff are both very happy to talk to you, right, when you need to know more. So they have put up their contact information. There's a lot of questions that just came through. And a number of you may have questions, may want to talk to someone. So
This is the interpreter. I'm sorry. It seems the screen share has blocked me from the deaf consumer. Is there a way we could change
sorry.
that? Thank you.
You got it fixed? Okay, good. Thank you. Thanks for catching that. But if you need to talk to someone, please feel free to just send an email and reach out. Send them your questions. They will get you answers. We want to be as supportive as we can be here in encouraging all of you as we go through this vaccine period and educating everyone. And with that, I think I am going to thank our panelists because we are 11 minutes over time, but we started a little bit late. And I want to thank all of you and thank our sign language interpreter for joining us today. And thanks to everyone who came for the active communication. We really appreciate it. We'll see you again soon for another Let's Talk. Thank you.